Hello, I'm Dr. Graw, founder of Right Time Medical Care, and this is your Apple Per Day. Today, we're here to talk about ear infections, or known in the scientific literature as otitis media, not uncommonly confused with otitis externa, or swimmer's ear, where it burns and itches on the outside. Otitis media is an infection in the middle ear, the chamber connecting the outer ear and the throat through the eustachian tube. The symptoms of ear infection are usually pain associated with irritability in small infants, inability to eat. Parents will report it hurts for them to swallow, they won't eat, or they'll poke at their ear. Clearly, you'd naturally assume that if you elevate the head, the symptoms will be much better, and that truly is the case. In older patients, it's most common that people will complain of fullness in the ear or an inability to clear their eustachian tube, a stuffiness that results from the upper respiratory congestion in the nose and around the eustachian tube. Most of the symptoms in older folks is because the eustachian tube is closed. That can be closed because the adenoids and tonsils are large, or because of infection right in the eustachian tube. It's because the eustachian tube pressure being closed allows for negative pressure in the middle ear. The eardrum gets sucked in, so it feels like something needs to happen. When the air then can pass through the eustachian tube, the eardrum will pop back to a neutral position and you feel relieved. As the eustachian tube remains closed, the air will be absorbed into the soft tissues, the eardrum will be sucked in, and you feel once again like you need to clear the space. Many folks will run around going to try and pop that air into the middle ear. That's only a temporary resolution. If you cannot permanently open up the eustachian tube, then there's not a normal equilibration of the air between the throat and the middle ear. Ear infections are most prominently caused by secondary complications of upper respiratory tract infections. The number one invader of that middle ear space is a virus and requires no special treatment. Secondary complications with bacteria occur much less frequently and require the use of antibiotics. Other organisms that you frequently hear about, like fungi that grow between your toes, do not invade the middle ear space. So bacterial infections are less common. Viruses are the number one cause. When there's negative pressure on the middle ear, then fluid will be drawn into the middle ear space like a warm bowl of broth sitting there to be infected. It takes one swallow. It takes one swallow with the stuffy eustachian tube, and 100 germs will pass from the throat up into the middle ear space. That warm bowl of broth being a welcome environment to perpetuate the growth of those bacteria or viruses. The most common cause for the infections is a virus, however. It's only when they become secondarily infected with bacteria that those middle ear infections need antibiotic treatment. Many home remedies can relieve the symptoms associated with ear infection or otitis media. Over-the-counter medicines such as Tylenol and Motrin can be used to relieve the pain. Suctioning the mucus from the nose, that clear mucus, particularly in small infants, allows the pressure to equilibrate around the eustachian tube, allows them to swallow, and allows them to eat better. Keeping the upper airway soft and open by using saline and/or suctioning following the saline will help relieve the symptoms of pressure. In older patients, the use of short courses of neosynephrine or Afrin will help relieve the pressure around the eustachian tube. Some folks feel gargling hot salt water will decrease the amount of swelling in the throat and allow them to swallow better, freeing the eustachian tube opening so that the pressure can be equilibrated with the middle ear. In years past, it was not uncommon for patients to believe that every ear infection required antibiotic treatment. It's now known that the majority of ear infections will respond to time. That means if I look at an ear today and it looks red, it may be perfect tomorrow whether they get an antibiotic for the treatment of that ear infection or not. Providers are now counseled to be very reserved with the use of broad-spectrum antibiotics over and over to treat middle ear infections if they're not being caused by bacteria. Speak with your provider, understand that the virus is causing the problem, find out what you can do to clear the virus in the nose and throat, and once that's taken care of and the mechanical fluid that's blocking the passageways to the eustachian tube is cleared, the ear symptoms may resolve. If the symptoms progress, particularly in young children, if they're associated with a high fever, if they're associated with a thick, pussy nose, drainage from the throat, it's likely that a viral ear infection can become complicated with a bacteria. For symptoms that are progressive of middle ear pain or upper respiratory tract infection, you should see your primary care provider. When you can't get to see your primary care provider, feel free to reach out for us at nighttime.com. This has been your Apple Per Day. Thanks for joining me. Stay healthy.